I'm Myles Linton. I'm a health economist here in Clark West and I work with the efficiency team. Health systems across the world, including the NHS here in England, have been under pressure to make cost savings, and one of the ways that clinical commissioner groups in particular have sought to address this challenge is by reviewing its prescription policies, particularly its prescriptions for gluten-free food for patients with celiac disease. At the same time, the Department of Health had launched a national consultation to explore whether the NHS should be responsible for providing these provisions. So the principal aims of the study were to examine the financial impact of these existing policy changes on the NHS, and also to look at the types of patients that might be most impacted by restricted policies around gluten-free food prescriptions. In this study, we used prescription data, population demographics and data on over 7,000 GP practices across England. And we also looked at the cost savings made within clinical commissioning groups that continued to prescribe gluten-free food as usual and compared their expenditure to clinical commissioning groups that had introduced more restrictive policies. One of the most interesting findings from the study was that in comparison to those clinical commissioning groups that continued to spend on gluten-free prescriptions as usual and saw fairly stable expenditure, those clinical commissioning groups that either introduced a complete ban on prescriptions for gluten-free food or a complete ban with age-related exceptions saw their expenditure on those products reduced by around 80% within 3 months. We also found that spending on those gluten-free products was highest in GP practices in more rural areas and with lower levels of deprivation, which gives us an indication of the types of patients that might be most impacted by restrictive policies. The larger ethical and economic question really is, what should the NHS be responsible for providing? And in this study, we've been able to show that introducing these more restrictive gluten-free prescription policies has been associated with quick wins financially for the clinical commissioning groups, but the longer term financial impact and the impact on patient outcomes at this point is still unknown.